Hello, everyone, and good morning. Today, what I want to talk to you about is how do I know that I have gingivitis? Gingivitis is the inflammation of your gum tissue. So, gingivitis is just the name for gum inflammation. So now you may want to know, how can I recognize that I actually have gingivitis? And one of the ways that you can notice that you have gingivitis is that when you look at your gum, you would see that your gum is changing color, and they're either really dark pink or they're kind of like reddish, and that's more than likely more recognizable on people who have gums that are pink, because there are different type of color for gum tissue depending on the person. So when you see that your gum are dark in color, darker in color, more like reddish, you would know that you have gingivitis. Another sign that would cause you to know that you have gingivitis is the fact that you'll see that your gum are more puffy. So they're not really thin, but you see areas where your gum are swollen, they are puffy. That's also another sign that would make you know that you have gingivitis. And then another one that you would know that you have gingivitis would be that when you're brushing your teeth, you will notice that your gum are bleeding. And of course, there are many things that can cause your gum to bleed, but like one of the telltale sign of gingivitis is bleeding gum. So what do you really want to do when you notice that you have gingivitis? Because some people, when they realize that when they are brushing their teeth, their gums are bleeding, they are thinking that maybe they're brushing too hard, or maybe like they are traumatizing their gum, or hurting their gum, and so that's the reason why the bleeding occurs. But it's not actually so. When you have gingivitis has a sign. One of the sign is bleeding gum. So what you want to do is actually, instead of deciding to stop brushing your teeth, you want to make sure that you actually do brush your teeth, because once you brush your teeth, you'll notice that you are removing the material that is stuck between your gum, causing the inflammation, the bacteria as well. You're dislodging it, and that is literally what is going to treat your gingivitis. So you want to make sure that when you brush your teeth, you are aiming the bristles of your toothbrush at the area between your gum and between your teeth. And it's not going to just take one day. So yes, when you start brushing, better, because some people do brush, but they're not brushing properly. So that's the reason why I'm saying that you need to aim the bristles of your toothbrush at the intersection between your gum and your teeth, because when you remove food debris and bacteria, slowly your gum is going to, the inflammation is going to go away, and little by little, your gum is going to regain its health. So basically what you want to do is make sure that you keep brushing your teeth, and also you want to make sure that you also floss, because the area between your teeth also need to be cleansed, and the bristles of the toothbrush are too thick, so they cannot reach between your teeth. So making sure that you are using proper brushing techniques and also flossing is going to start reversing the process of gingivitis for you. But when you do have hard plaque, which is also one of the factors that would cause you to have gingivitis, you actually want to go to a dentist, so that the dentist can remove, the tartar on your teeth, or the calculus on your teeth, and that's going to start reversing the process of gingivitis for you. So some of the things, as we said, that you can do in order to release or remove, or treat gingivitis is brushing properly, flossing properly, and also make sure that you go to your dentist that's going to clean your teeth with the special tools and instruments, and that's going to reverse, your gingivitis for you, because gingivitis is not like a doom fact. It is reversible once you do those things. And the doctor may or may not decide to also prescribe you some some mouthwash. Oftentimes with some people, when they have a lot of bleeding, I may prescribe chlorhexidine or Peridex, and that's going to be antibacterial and is going to decrease the bacterial load, obviously reversing gingivitis as well. But that would be at the discretion of your dentist, which is one of the reasons, again, why you want to go and see a dentist, so that your gingivitis can be reserved. So in short, that's what I wanted to talk to you about today, is what gingivitis is, how do you actually recognize it, and what can you do about it in order to reverse it. So if you have found this information to be valuable, please do not hesitate to share this information with your friends and family that can benefit from the information. I am Dr. Valerie Mukanga. I am the owner and founder of Healing Wings Dental. We are located in Arlington, Texas, in the Dallas-Fort Worth area. If you do not have a dentist that can take good care of you, I am the one. I can help you. We have an office where everyone is compassionate and you will be treated as family. So that's what I wanted to share with you today, and I wish you a great day. Make sure you make your day positive, because it is in your reach. Have a good day. Bye-bye.